It's a Sunday morning. You're 58. You're sitting at the kitchen table, maybe still in your pajamas, coffee going cold next to the laptop. You open the retirement spreadsheet you've been quietly building for 2 years. The 401k column says $2 million. The math works. Every calculator you've run says you can walk out of that office tomorrow. So you decide to take one more step. You go to an insurance company's website just to get a quote, just to see what coverage looks like before Medicare kicks in at 65. You type in your age, you hit get quote, and you just freeze. The number on the screen doesn't look like a monthly premium. It looks like a mortgage payment for a house you don't own. You close the laptop. And somewhere in the back of your head, a quiet voice says, I guess I'm working 5 more years. I've watched this happen to people who had done everything right. People who had saved, invested, lived below their means, and still found themselves trapped. Not by a lack of money, by a gap in the system they didn't know existed. That gap has a name. It's the 7 years between your last paycheck and your first day on Medicare. And that stretch can cost more than a brand new Porsche 911, just in insurance premiums, if you go in blind. This is the part no one puts in the retirement brochure. Most people don't think of healthcare as a gatekeeper. But once you've seen that quote, that's exactly what it feels like. It sits between you and the freedom you spent decades building, and it doesn't move until you understand how the system actually works. And here's what makes 2026 different from the years before it. A major policy change just went into effect in January. Something that was quietly protecting millions of early retirees expired at the end of 2025. It's back now. A hard income cliff that can wipe out tens of thousands of dollars in subsidies overnight based on one number you might not even know you're generating. We're going to run through each of these today. The COBRA math, the subsidy cliff that just came back, and one planning conflict most people don't see until it's too late. If that's the kind of thing you want more of, practical, no-spin retirement strategy, hit subscribe. I put these out regularly, and the next few topics are ones you'll want to see before you make any major moves. On your last day at work, HR hands you a folder. It's thick, dense, full of forms printed in that particular shade of corporate gray that signals read this carefully. But somehow also we know you won't. Somewhere in the middle of that folder is a section on COBRA, your option to keep your current health insurance after you leave. And for a lot of people, the decision feels obvious. Same doctors, same network, same coverage. You're already dealing with 1,000 other things that day, the goodbyes, the cleanup, the strange mix of relief and anxiety. So you think, I'll just keep what I have. You sign. You move on. 3 months later, you're looking at your bank account and doing the math for the first time. When you were employed, your company was quietly covering 70 to 80% of your premium. You saw maybe $300 come out of your paycheck. That felt like the full cost. It wasn't. You never saw the rest because it never touched your hands. COBRA doesn't change your coverage. It changes who pays. Now you pay the full premium, plus a 2% administrative fee on top of that. For a single person, that can run $800 to $900 a month. For a couple, and this is where it gets uncomfortable, you're often looking at $1,500 to $1,800 a month. That's $18,000 to over $22,000 a year, based on KFFA's national benchmark data for employer-sponsored plans. Money going out every month to maintain the exact same plan you had before, just without anyone else sharing the weight. I know what that HR folder looks like. I've been through one myself, and I won't pretend the language in it is designed to make things easy. That document isn't written for clarity. It's written for legal compliance. Nobody reads it the way HR assumes. But the confusion is worth pushing through because the COBRA decision is one of the few you can't easily reverse. What you're buying with COBRA is familiarity. Same doctor, same prescriptions, no paperwork. That's real value. The question is whether it's worth $1,500 a month. For some people, that's the right call. If you have ongoing care, a specialist relationship you don't want to interrupt, or a procedure already scheduled, COBRA's network stability has actual value. Paying $1,500 a month to not disrupt active treatment is sometimes the right math. But for a healthy couple in their early 60s with no major ongoing care, COBRA can quietly drain $30,000 to $36,000 out of your retirement assets over those 18 months. Money that, if you'd left it alone, would be working for you instead. That's the long-term cost that doesn't show up in the folder HR hands you. So where do people go after COBRA runs out, or when they decide it's not worth the price? Most of them end up looking at the ACA marketplace. Obamacare, the exchange, and in theory, the math there can look completely different. Income-based subsidies, significant premium reductions, the possibility of paying a fraction of what COBRA costs. But the rules just changed. What was protecting millions of early retirees for the past few years? An expanded subsidy structure that made ACA genuinely affordable across a wide income range. Expired on December 31st, 2025. And what came back in 2026 is something a lot of people haven't dealt with before. A hard cliff, one that doesn't ease you down gradually, one that drops you straight off the edge. Let me tell you about a washing machine that cost $15,000. John and his wife are both 61. Combined, they have just over $3 million in assets, 401k, brokerage, some savings. On paper, they're in great shape, but they've been careful about income. Very careful. They know how the ACA works. They've structured their withdrawals to keep their modified adjusted gross income, their MAGI, below a specific threshold. And it's been working. Their monthly premium on the marketplace is manageable. They're receiving a meaningful subsidy. Then the washing machine breaks. John sells a small position in his brokerage account, $2,000 worth of stock. Enough to cover the appliance, handle the installation, move on. It feels routine. It is routine. Except that $2,000 pushes their combined MAGI over the 400% federal poverty level line by just over $1. At tax time, the IRS sends a reconciliation notice. John and his wife owe back every dollar of the ACA subsidy they received that year. All $15,000 of it. One transaction, $1 over the line. A washing machine that ended up costing $15,000. It's not a gradual phase out. There's no cushion. You're either under the line or you're not. And if you're not, the subsidy disappears entirely and you owe it back. For a married couple in 2026, the 400% federal poverty level threshold sits at roughly $84,600 in MAGI. At $84,500, ACA caps your premium at around 8.5% of your income. For most couples, that means a subsidy doing a lot of the heavy lifting, sometimes $12,000 to $18,000 worth per year, depending on your age and where you live. At $84,700, you pay the full unsubsidized premium. For a couple in their early 60s, that's often $20,000 or more annually. The difference between those two income numbers, $84,500 and $84,700, is $200. The difference in annual healthcare cost can be $15,000 or higher. That's not a marginal penalty. That's a cliff. And here's the part that trips up even the people who've done their homework. This cliff was gone for a while. The American Rescue Plan expanded subsidies in 2021 and removed the hard 400% cutoff, creating a smoother phase out for people above that line. Those enhanced subsidies got extended, then extended again, and then, at the end of 2025, they expired. Congress didn't renew them. So 2026 is the first year in several years that a retiree managing their income carefully, doing everything right, can get knocked off this cliff by something as ordinary as a stock sale, a part-time consulting check, a required minimum distribution they forgot to factor in, or yes, an appliance that broke at the wrong time. What makes this particularly hard to manage is that the number that matters isn't your spending, it's your MAGI. And those two things are not the same. You can spend $90,000 this year and report $40,000 in MAGI if you know which accounts to draw from. Or you can spend $70,000 and accidentally report $87,000 in MAGI because of how you liquidated assets. The cliff doesn't care about your lifestyle. It only cares about the number on line 11 of your tax return. This is why people with significant assets, people who are, by any reasonable measure, financially comfortable, can still get hit. The cliff isn't about whether you have money. It's about whether you understand the difference between income and wealth and whether you've structured your withdrawals accordingly. If you've ever gotten a surprise bill at tax time after a year on ACA coverage, drop a comment below, because the number of people who've run into this is higher than most people realize. But before that, the cliff is only half the problem. The logical response is to keep your MAGI low. Simple enough, right? Stay under the threshold, protect the subsidy, move on. Except that strategy runs directly into a piece of advice you've probably heard, maybe even followed, that is mathematically sound in isolation, but in this context becomes one of the most expensive mistakes an early retiree can make. I have to be honest about something. A few years back, I was telling people the same thing you've probably heard a dozen times: the window between retirement and age 73, before required minimum distributions kick in, is your golden opportunity for Roth conversions. Your income is low, your tax bracket is temporarily favorable, and every dollar you move from a traditional IRAs into a Roth now is a dollar that grows tax-free and never gets forced out of your account on the government's schedule. That advice is mathematically correct. I still believe the underlying logic. What I got wrong was the order of operations. I was solving for one problem, future tax efficiency, and completely ignoring the live wire sitting right next to it. When I watched a client absorb a $14,000 subsidy clawback in a year they thought they'd planned carefully, I had to sit with that for a while. The strategy was right. The sequencing was wrong. And the sequencing is where people actually lose money. When you do a Roth conversion, you take money from your traditional 401k or IRAs, money that was never taxed, and move it into a Roth account. The amount you convert gets counted as ordinary income in the year you do it. Every dollar converted is a dollar added to your MAGI. You already know what MAGI does to your ACA subsidy. So meet Sarah. She's 59, recently retired, in good health. She has a traditional 401k with $800,000, a small pension that pays $25,000 a year, and she's been receiving an ACA subsidy that brings her monthly premium down to something reasonable. Her base MAGI from the pension sits around $25,000, well below the 400% cliff. Sarah watches a video, maybe not unlike this one, that explains Roth conversions. The logic makes sense to her. She decides to convert $50,000 from her 401k to a Roth IRA. She's in a low bracket right now. She figures she'll save maybe $5,000 in future taxes by paying the lower rate today instead of a higher rate when RMDs force distributions later. That part is correct. What happens next is that her MAGI goes from $25,000 to $75,000. Still under the cliff, actually. She's okay this year. But she liked the result, so the following year she does it again. Another $50,000 conversion. Now her MAGI is $75,000 plus the next conversion, and depending on her exact numbers, she's either right at the edge or over it. 1 year over the cliff. Subsidy gone. She owes back $14,000 to $16,000 at tax time. The net math, she saved roughly $5,000 in future taxes through the conversion. She lost $14,000 in ACA subsidies in the current year. That's a net loss of around $9,000 from a strategy that was, in isolation, completely rational. This is the trap, not because Roth conversions are bad, not because ACA subsidies are unreliable, but because optimizing hard for one variable without modeling the other creates fragility exactly where you can least afford it. In your healthcare costs, which are non-negotiable and non-deferrable. They just pull in opposite directions during the same 5 to 7 year window. Roth conversions push your income up. ACA subsidies need it to stay down. Same window. You can't run both at full throttle simultaneously. Something has to give. What most people don't realize is that the choice isn't binary. It's not do Roth conversions or protect ACA subsidies. The actual question is, how much conversion can you do in a given year without crossing the cliff? And in which years? Based on your specific income sources, your subsidy amount, your tax bracket, and your asset mix. Does it make more sense to convert? And in which years does it make more sense to hold off and protect the subsidy instead? That calculation changes every year. It depends on your pension income, any part-time work, capital gains from your brokerage, Social Security timing if you've started taking it. The reason most people get this wrong isn't carelessness. It's that they're getting advice optimized for one dimension of the problem. Your insurance broker is worried about your monthly premium. Your tax advisor is optimizing for decades from now. Neither of them is running the number that covers both. I don't think there's a clean answer that works for everyone here. The right conversion amount depends on variables that are specific to your situation. But the tool that makes it manageable, the thing that lets you spend what you actually need, keep your MAGI where it needs to be, and still make progress on Roth conversions in the right years, is how you sequence withdrawals across different types of accounts. Which bucket you pull from, in what order, and in what proportion. That's what we're building in the next section. When I first had to buy my own health insurance, no employer, no group plan, just me figuring it out. I spent a lot of time learning how the IRS thinks about income, not earnings, not spending. Income as the government defines it. That distinction ended up saving me more money than any investment decision I made that year. What I figured out, eventually, was that the IRS doesn't see all money the same way. And that matters more than most people realize. Not all withdrawals are created equal. Think of your retirement assets as sitting in 3 separate buckets. Each bucket has a different relationship with your MAGI. Bucket 1 is your cash and after-tax savings. Money sitting in a regular savings account, a money market, a checking account. When you spend from this bucket, the MAGI impact is 0. You already paid taxes on this money. The government has no further claim on it. Every dollar you pull from here is invisible to the ACA calculation. Bucket 2 is your taxable brokerage account, stocks, ETFs, funds you hold outside of any retirement wrapper. When you sell, what hits your MAGI isn't the sale amount. It's only the capital gain, the difference between what you paid for it and what you sold it for. If you bought a stock for $8,000 and sold it for $10,000, only $2,000 touches your MAGI. The other $8,000, your original basis, passes through clean. Bucket 3 is your traditional IRAs and 401k. Every dollar you withdraw from here counts as ordinary income and lands directly in your MAGI, dollar for dollar. This is the bucket with the most retirement savings in it for most people, and it's the one that requires the most deliberate management before 65. Now let's make this real. Say you're a 60-year-old engineer. You want to spend $90,000 this year. If you pulled everything from bucket 3, your traditional IRIs, you'd report $90,000 in MAGI. For a single person, that likely puts you well over the 400% cliff. Subsidy gone. Full premium exposure. But that's not the only way to get to $90,000. Instead, $40,000 comes from bucket 1, cash savings. MAGI impact $0. Another $25,000 comes from selling positions in bucket 2, your brokerage, where the capital gains on that sale are only $5,000 because your basis covers the rest. MAGI impact $5,000. The remaining $25,000 comes from bucket 3, your traditional IRAs. MAGI impact $25,000. Total spending $90,000. Total MAGI reported to the IRS $30,000. At $30,000 in MAGI, a couple in their early 60s qualifies for a substantial ACA subsidy, potentially $12,000 to $18,000 worth of annual premium assistance, depending on location and plan tier. That's the difference between a manageable monthly cost and a number that sends people back to work. Same lifestyle. Engineered income. This is what I mean when I say the cliff isn't really about how much you spend. It's about which door you walk through to get the money. The capital gains piece is worth pausing on because it surprises people. Most investors think of a stock sale in terms of the full proceeds. But if you've held a position for years and your basis is significant, a large portion of that sale is simply your own money coming back to you. Not income in any meaningful sense, and not income in the IRS sense either. Managing your basis across positions in your brokerage account is one of the most underused tools in early retirement planning. It's legal, it's well documented, and almost nobody brings it up. There's a timing dimension here, too. The bucket strategy doesn't work if you build it the year you retire. You need at least 1 full year of runway. Ideally 2, to position the buckets correctly. That means knowing in advance how much you need to spend, which positions in your brokerage have low basis versus high basis, and whether your cash reserves are sufficient to cover 1 to 2 years of living expenses without touching the IRAs at all. People who do this work before they retire gain something that's hard to put a dollar figure on: flexibility. When a medical expense comes up, when a roof needs replacing, when a grandchild's tuition comes into the picture, they have options. They're not forced into a large IRA's withdrawal at the worst possible moment. People who don't plan this in advance end up reactive. And reactive, in the context of the ACA cliff, can mean $15,000 or more in unexpected premium costs in a single year. Building and maintaining this structure takes ongoing attention. You need to track your MAGI throughout the year, not just at tax time. You need to model Roth conversion opportunities against subsidy exposure each year individually. It's not passive, but neither is working an extra 5 years because you didn't know the mechanics. For most people I've talked to, the bigger problem wasn't the costs themselves. It was just not knowing the mechanics soon enough. Once you understand which buckets you have, what each one costs you in MAGI terms, and how to blend withdrawals to hit your spending target without triggering the cliff, the math changes entirely. The system that felt like it was working against you starts working for you instead. There are really 2 ways this plays out. Path 1, you keep working. Not because you love the job, not because you need the mental stimulation, but because the health insurance comes with it, and the alternative feels too uncertain. You stay until 65. You hand Medicare the decision instead of making it yourself. And somewhere in those extra years, you spend the time and energy that you can't get back. Path 2, you understand the cliff. You stop doing Roth conversions on autopilot. You build the 3-bucket structure before you walk out the door. You spend what you actually need, report what you're actually required to, and you keep a subsidy that pays for a significant portion of your coverage until Medicare takes over. Same assets, same retirement account balance, but the difference in healthcare costs alone over those 7 years can be $80,000 to $100,000. That's the sequencing gap. That's the whole game between 58 and 65. The years are the one thing you can't restructure. Everything else, the MAGI, the buckets, the Roth timing, those are solvable. They're technical. They reward preparation. The next video covers the RMD's side of this. What happens when the government starts forcing withdrawals at 73 and how that changes the whole calculation. If this video helped untangle even one part of the healthcare planning puzzle for you, I'd appreciate you sharing it with someone who's running the same numbers in their head right now. There are a lot of people quietly assuming they have to keep working because of this gap, and most of them just haven't seen the full picture yet. I'm Wes. Subscribe if you want more of this practical, specific, no-spin retirement strategy. I'll see you in the next one.